Negotiations are taking place right now, everybody, on new stimulus bills. Many Social Security beneficiaries and low-income households may be eligible to claim $100 stimulus checks. These payments may be provided on a monthly basis, and Democrats in House Representatives have introduced stimulus relief proposals aimed at sending direct payments to Americans to help cover high gas prices. The plans have some similarities to the one that sent $1,400 checks to millions of people last year during the crisis. This week, oil prices continue to fall even further after the Biden administration said it would urge lawmakers to suspend the 18.4 cents a gallon federal gas tax in an effort to take the heat off of prices. One proposal by Mike Thompson, John Larson, and Lauren Underwood would send what they call an energy rebate of $100 per month for individuals or $200 per couples, plus $100 for each dependent. The payments would go to people based on their income and would follow the same guidelines as the 2021 economic impact payments. Single filers earning up to $75,000 or married couples filing jointly earning up to $150,000 will be eligible as well. Peter DeFazio, everybody, announced the Stop Gas Price Gouging Tax and Rebate Act. The bill calls for households to receive a monthly advance tax credit, similar to last year's monthly child tax credit. The money would come from taxing oil companies for what DeFazio calls excessive corporate profits. In an official statement, DeFazio said Big Oil will pay a one-time 50% windfall profit tax on any adjustable taxable income in 2022 that exceeds 110% of their average adjustable taxable income during pre-crisis levels between 2015 and 2019. The size of the payments to Americans would be based on how much money is raised by the tax on the oil companies. A similar bill introduced by March 10th also targets big oil companies but calls for quarterly payments to Americans who meet the same income thresholds. The extra tax would hit large oil companies that produce or import at least 300,000 barrels of oil per day, or did in 2019. Representative Khanna, one of the two main sponsors of the company, said so the companies will owe a per barrel tax equal to 50% of the difference between the current price of a barrel of oil and the pre-crisis average price per barrel between 2015 and 2019. Khanna said it would impact companies like ExxonMobil and Chevron, but smaller oil companies would be exempt. He estimates that at $120 per barrel of oil, it will result in a single filer getting $240 per year and joint filers receiving $360. And according to an agency watchdog, the IRS backlog of tax returns has swelled over the past year, despite efforts to clean the pile up. The Taxpayer Advocate Service shared in its mid-year report to Congress that there were 20 million unprocessed paper returns as of May 31st, up from 20 million the year prior.
For your service and for being here today. Speaking of horrible statistics, this country is 38th out of 41 industrialized countries in the world in terms of the scale of our childhood poverty. The poorest people living in the United States are our children, and for one brief shining moment, for 6 months, thanks to your efforts and the efforts of your employees at Treasury, we expanded the child tax credit based on the bill that I wrote with Senator Brown, cut childhood poverty in this country almost in half, benefited 90% of the kids in this country, reduced hunger in the United States by 25%. It's hard to think of anything, Mr. Chairman, that we've done here in generations that has made more of a difference for working families. And tragically, we let it expire. Now, there were people on the front end of this who said, this is a terrible idea, it's going to disincentivize people from working, people are going to use the money, for all kinds of illicit purposes. I can tell you, Madam Secretary, people spent the money in Colorado on their kids, and the list is long, from school supplies to lessons on instruments to back-to-school clothing. But the one thing everybody has in common, when I asked them what their experience was with the enhanced child tax credit, it is the amount of stress that it relieved from their family. Because after all, people in Colorado live in the same economy that this entire country lives in. It's an economy that for 50 years has worked really well for the top 10% of Americans and hasn't worked for anybody else. Washington's response over that period of time has actually been to make worse our income inequality by cutting taxes to the tune of about $8 trillion since 2001. Almost all the benefit of that went to the wealthiest people in the country. It made our deficits worse, it made our income inequality worse. It's staggering that that is what we would do. And finally, we finally did something for working people with the enhanced child tax credit and the enhanced earned income tax credit. And at the end of the year, we turned our backs on the poor children in America that benefited from this, the 90% of kids that had the benefit of this. I've been here.
Thank you, Madam Speaker, and I thank the gentleman from Connecticut for yielding. Madam Speaker, more than 2 million federal employees provide key services to the public. In fact, during the height of the pandemic, federal workers were critical in delivering vaccines, personal protective equipment, and other COVID relief to the American people. So it stands to reason that when a federal worker gets sick or injured on the job, we are obligated to provide them and their families with the resources and medical care that they need. Today, we can improve that effort by providing expanded health care access for injured federal workers who are seeking health care covered by federal workers' compensation. We live in a country where people are increasingly turning to nurse practitioners and physician's assistants as their primary health care provider. This is particularly true in rural America, where they are disproportionately impacted by physician shortages. Unfortunately, federal law now limits what can be reimbursed under federal workers' compensation, forcing injured workers to seek only a physician to certify injury and disability as work-related and to deliver services. It is time to correct this lag in access to health care. After all, core federal health care programs, including Medicare and Veterans Affairs System, already recognize services delivered by nurse practitioners and physician's assistants if provided within the scope of practice allowed by state law. This bill will allow nurse practitioners and physician's assistants to receive reimbursement for health care services they are providing to injured federal workers if and only if those services are already permissible under their state laws. Madam Speaker, a yes vote on this bill is a step to expand the group of available health care providers consistent with existing state law so that we can ensure injured federal workers and their families get the support and care they deserve. I want to thank the gentleman from Connecticut, Mr. Courtney, for his leadership on the bill, along with the distinguished member of the Education and Labor Committee, gentleman from Michigan, Mr. Wahlberg, and the committee ranking member, Dr. Fox, for their support of this legislation. And I urge my colleagues to support the improving access to workers' compensation for injured federal